I'm going to hit record now. And
all right, are you able to see the screen? Okay.
Yep.
Wait, are you ready, Kenna?
We're good.
All right. I want to welcome you all to Healthy Bladder Habits That Might Help You. Urine Not Alone, of course. And I'm Joan Bowling, the Kenton County, one of the Kenton County Family and Consumer Sciences agents here. And Ken and I are tag teaming today. So she'll begin a little bit, and then I will take over in just a minute. Kenna, do you want to introduce yourself?
Oh, yeah. I am Kenna Knight from the Pendleton County office, and we welcome you today. Joan and I have had fun putting this lesson together. Hopefully you enjoyed the opportunity to watch Joan's commercials that she and her program assistant did and advertising for it on some of our social media sites. If not, you missed some entertaining and maybe how we all feel sometimes in the process of dealing with the issue we're going to talk about today. So we're excited to dig into it. We have learned a lot about it, and we're going to share some stories even about ourselves. So maybe you feel more comfortable knowing it's not just it's an everybody issue almost. So Joan's going to cover a little bit to begin with, and then I will. Well, what's your team? You'll have a plan. One of us will be talking to you.
We'll figure it out as we go. I lost my original notes, and I think I got it. So today, of course, we're talking about urinary incontinence, and in this lesson, we're really going to try to be talking about mainly, of course, the incontinence issue. But before we present the outline, it's the definition of urinary incontinence is the premature triggering of the voiding reflex resulted in the voluntary bladder contraction and urethral relaxation, and just means that, listen, you're going when you don't intend to go. We all know what incontinence is. So the objectives, really what we mainly wanted to make sure that you understood is learn about what urinary incontinence is, its prevalence among women, and when to seek help from your healthcare provider. There are so many women, as Ken and I will share throughout this, that it starts to impact your life. And when it starts to impact your life and your comfort level and being out in public and so forth, it's really important that you do seek more help. But hopefully from this lesson, you'll learn some things that you can do on your own and how you can practice good bladder habits. I know I certainly learned a lot from reading over this lesson. I know Kenna did as well, that I wasn't aware of, that I actually was doing more harm than good to my pelvic floor than good by going to the bathroom when I thought that I needed to, when I really didn't need to go. So we're going to learn the structure of the pelvic floor and strengthening movements to gain floor control of urinary incontinence, and discuss some good bladder habits, and we'll be giving you material on the pelvic floor strengthening exercises. I'm not going to demonstrate those for you today, and I would, if we were in person, we would certainly do some of that, get down on the floor, and certainly you could practice these at home for sure. Some things that we often might feel uncomfortable doing at first, but when we recognize that the benefit certainly outweighs the discomfort later, being on the floor and practicing those exercises. And then also we'll learn about some foods and drinks that could irritate the bladder, some possible irritants that we might have in our regular that we eat on a regular basis that might trigger the bladder to want to void itself. So in this lesson, you're going to learn how it affects your life, the process of the urination. We're going to talk about that. Almost a science, definitely a health lesson. The different parts of your body that play a role, the types of issues that women have, and how to gain control. and when to seek help. You may have noticed that some days that you have to pee more than other days without really having any more water. If in this case, you may be running into an issue where certain food or drinks are acting as a bladder irritant, or maybe every time you get home from work, you're having to rush straight to the toilet as soon as you get into the house. And these are all things that we're going to address in this lesson. So how many of you would be willing to share if there are days that you need to go to the bathroom more than others? You can either raise your hand, or if you have to rush to the toilet when you get home from your destination. Is that an issue for very many people?
And if your video's on, we can see you shake your head even, yes.
Yeah, you can shake your head.
Yeah.
So, and we'll talk about that as well as we go through the lesson, because it has a lot to do with your brain as well. Your brain is working in unison with your bladder. So sometimes we train ourselves to go to the bathroom, like when we're getting ready to go on a trip and we're getting in the car, like everybody has to go to the bathroom because that's what you do before you get in the car for a couple of hours. You make everybody go to the bathroom. But unfortunately, that might be doing your bladder, your pelvic floor a little bit of not doing it a favor by training it to do that. So you're supposed to train it to hold it. So, Kenna, did you want to?
Yeah. So Joan's going to stop sharing her screen for a second so I can share, and this is going to be one of our specialists at the university, and it's kind of her story. And so she did put this lesson together, or was part of this lesson in the planning process. So I'm going to share her story, and then you might even hear a story that Joan and I might share with you about ourselves. And I'm going to hit play, and hopefully everybody can see.
We all have stories. My story started back when I was 15 years old. And when I was 15, I loved doing gymnastics and ballet and all kinds of active things. And when I was 15, I jumped over what we called a horse then, I think they call it a vault now, landed wrong, and tore my knee. When I was 16, I did it again. When I was 17, I did it riding a bike. Then when I was 19, I did it fencing. So at that point in time, I decided that kind of activity was no longer for me. They could do surgery, but way back then when they did surgery, they actually laid your knee wide open and could do more damage. And seeing that my knee was decently stable, I stopped playing tennis. I stopped water skiing. I stopped, obviously, gymnastics. That I stopped after the second injury. And that was how I solved it. So I could run, I could hike, I could jog, I could walk, and that's what I did for physical activity. So the world was okay. Then when I was 26, I had my first child. And the world was pretty good then, really pretty good. And she'd gotten to a decent age, and we had a babysitter, and my husband and I decided we were going to go out running. Well, really, jogging. So we went out jogging. It was late at night, and I started laughing. And I said, look. And my husband looks down as I am wetting myself, and there is this huge puddle on the pavement, of which my husband says to me, stop it! Of which I said, if I could, I would. So, as to what I had done previously when I did knee injuries, I stopped the activity that caused it. So I didn't jog anymore. That was okay. I could still walk and could run, but jogging was worse. After a couple years, everything got better. Life was great. I could actually do a little jogging, not a lot, but a little jogging, and the world was wonderful. And then menopause. Menopause has a whole new set of issues. one of the issues, and it's the one that I have, is called key in the door. And I believe it's all up here. It probably isn't quite all up here, but part of it is up here. And a key in the door means to me that you have to go to the bathroom. Because when I go through my garage door into my house, the first thing I see is the bathroom. And I have to make a mad dash to that bathroom. And so that's what you learn, is that you have to make those mad dashes to the bathroom. Or the other thing is you stand there and say, you can hold it, you can hold it, yes you can hold it, and then you have to practice and do some exercises to make it easier. So we all have a story to tell. I have also found that there are certain citrus beverages that give me more trouble with the key in the door. And so guess what? I don't drink those either. And I don't drink tea because tea gives me a problem. So now I don't drink tea. I don't drink orange juice. I don't drink grapefruit juice. I don't drink pineapple juice. I don't go jogging. And that's a life story. And so the impact of urinary incontinence has impacted my whole life. And it is time to do something more about it.
So that was Janet's story, and I will kind of share Kenna's story on it, and then Joan might share her story a little bit as we pull back up the PowerPoint slides here in just a second. So Kenna's first experience with this, and surprisingly enough, I've heard stories on it with my kids, especially my middle daughter who does run. So apparently jogging and running might have some effect on it. But she would send funny messages to her sister and I, because she's very open about it. Oh, guess what just happened when I was in my exercise class? So she was very open about it, where I was like, okay, no. But I went to the jump zone with my granddaughter, and let me just tell you, I had already been through that kind of phase that if you knew you had to sneeze and you were standing up, you kind of crossed your legs when you sneezed. So I was already in that phase. But when I decided I was going to jump on that trampoline with my granddaughter, which I haven't probably jumped on a trampoline since my kids were jumping on trampolines, it was not pleasant. I immediately had to get off and go to the bathroom. And I decided the next time that I was going to the jump zone ever again, because I didn't want to give that up, I was going to wear poise. And the girls laughed at me, but that was just the real life. It's where I was at, something in that jumping motion. I exercise quite frequently, but I cannot jump and exercise because I have no control then in that jumping motion.
One of my stories, I think when this class came about, my mind went directly back to last Thanksgiving Day. And the Thanksgiving Day race, as some of you may be familiar, is a 10K through Northern Kentucky and Cincinnati. And my son and his future wife, who's now his wife, were in town, and we decided, and she's a former runner. She ran cross country through college, and I thought, wow, what a great bonding experience for her and myself and my daughter, Olivia, to sign up for the race. So I signed us all up, the three of us, up for the race. And of course, you're there with thousands, tens of thousands of other people. We meet at Paul Brown Stadium, and you just can't go to the bathroom enough before you're going to go run a 10K. So I went multiple times before the race. And as I'm running, not that I was running that fast, not that fast, I didn't come in last. As I'm running, I get towards the end, and I'm like, why am I so wet? Is that sweat? And it most certainly was not sweat. I had no idea that I had emptied my bladder on myself, and just among all of the other people that were sweaty. I was hopeful that everyone just thought it was sweat. But it was quite embarrassing as well, because we get back in the car and it's like, yeah, we need to get home pretty quickly so I could change. But because I didn't need to go to the bathroom at that point. But then the things, as I recall, prior to that, that 6.2-mile run, I had been on the treadmill and training for that. And I noticed that when I needed to go while I was on the treadmill, instead of holding it through my run, I would get off the treadmill and go to the bathroom at the gym. And what I was doing was not training my bladder, or not my bladder, but my pelvic region or my muscles there to hold it. And so since Thanksgiving of last year, I continue to run about 6.5 miles a day, 5 days a week, but I am not getting off of the treadmill when I sort of feel the urge that I need to use the bathroom. I consciously have to make myself hold in the urine so that I don't end up like that again in a situation where if I couldn't go. Another thing is, my daughter, who is 20, is a weightlifter, and she might be horrified to know that I'm sharing this story of her, but she had started complaining around the time that we planned this class. She started complaining about how often she felt like she was leaking. And I said, Olivia, you are leaking. And this is why. And so trying to train her at 20 years old. So it's very common for young athletes to also have this issue. It's not something for just older ladies or ladies that have had children. It is for all of us. So hopefully you can share this PowerPoint or these slides and the information that we share with you with younger women in your family, so that they recognize what they can do to help keep this problem from occurring in their lives. So.
And Jen and I thought it was really important to at least share both of our stories, even about our children, because it is a problem or an issue that 1 out of 6 women experience. And they actually really think that number is quite a bit higher because so many people do not talk about it. I tried to encourage my daughter when she went in for her well care visit to talk to her physician, because it was a new physician to her, because she's recently moved out of state, about it. But she did not, because she chose not to. And that's where, this number might say 1 in 6 right now, but really they believe that number is a lot higher because so many people are somewhat embarrassed by it and choose not to discuss it. The next slide kind of gives you a breakdown of the percentage based on age level. Joan and I just mentioned 2 people that we know personally, very close to us, in that 20 to 39 age, which is, about 6.9% of those have it. And I just shared with you that my daughter, even though she had it, she wouldn't be counted in this number because she hasn't shared it with anyone. When you get to that 40 to 59 year age, it goes up a little bit higher to 17.2. And that's Joan and my story. That's where we're at. And then even as you get older in age, the numbers continue to go up. Some of that reason, we've gone through childbearing, that plays a role in it. We've gone through menopause, as Janet even mentioned, in that process. And then also just with age, muscles get weaker. And that's why it's important, just like not just every muscle. So that's why we're going to go over some of those pelvic floor, or at least discuss them and show you some opportunities where you can do, practice them on your own. Those use of those muscles, strengthen those muscles. So hopefully as you age, those muscles stay stronger for you. Urinary leakage affects all areas of your life. I mean, not just physically, it affects you emotionally as well. And that's what this slide sort of talks about. People that tend to have urinary leakage tend to not live as quality of a life, depending on the extent of that leakage, as someone who may not. And because, 1, you might be embarrassed. 2, you limit your social engagement because you're afraid of what might happen. So there's a lot of different things. So besides just the physical component that's going on with your body, you reduce that physical activity, you might experience some weight gain because you're more sedentary. You shy away from intimate relationships. You have a decreased sexual desire because of it. And then you tend to lose sleep, which also affects your health, emotionally as well as physically, because you're getting up a lot to go to the bathroom at night. Those emotional things that people get depressed. People are anxious because of it. They're wondering or worried if it might happen again. I'm sure the next time Joan went out and ran or did something running, in the back of her mind was that race. So then you become anxious, and you become a little more anxious about the situation. You feel embarrassed. Sometimes you worry like, oh, I know this happened. Can somebody else smell that this happened? Or can they think it maybe is, something different? It could cause marital trouble. And then you avoid those social settings, which we all are avoiding now, unfortunately. And we just know, even from COVID, the mental strain that avoiding those social settings have played on a lot of us. And then sometimes you might, your work might be less effective, or you reduce your workload. So Joan's going to tell you a little bit about how that bladder works. Let her do the scientific fun part.
So now that we know a little bit about how common urinary incontinence is, and it really can have such a great effect on our lives if we leave it untreated, we really wanted to share with you the anatomy of the bladder to help understand how it works and why the leaking occurs. And once you understand how it all works, then it will be helpful, I think, in maybe helping yourself as well. So the goal of the urinary tract system is to allow a urine to accumulate in your bladder and then empty the urine periodically at times that are convenient and, of course, socially acceptable, socially appropriate at that time. So two major players in a properly functioning urinary tract system are the pelvic floor and the brain, of all things. At some point, as children, we all learned to sense when our bladder was filling, and then also when and where it was appropriate to go ahead and use the bathroom. So just as a child learns to use the muscles in their legs to walk, a child also learns to help use the muscles of the pelvic floor to become continent or potty trained. So many of us on here that have had children and had to go through the potty training phase with our children also recognize that all children potty train at a different time. Not every child can potty train at 2.5 or even 3, because it is whether or not the pelvic floor muscles are developed enough and the brain and the pelvic floor are working in unison. So when you're looking at the picture here, you see the front. Make sure you understand which is the front and the back of the pelvic region. So to point out, see the bladder, and then the hammock up underneath there. Maybe I can, this part right here being the pelvic floor. So there you've got your bladder and the pelvic floor that looks like a hammock. So the pelvic floor is made up of a group of muscles that are connected to the bottom of the pelvic bones. And you can think about the muscles like the hammock that covers a large space and that exists between the pelvic bones. In women, there are 3 separate holes that exist within the pelvic floor. The first is the urethra. If you'll see that on there, the urethra. The second being the vagina, that is connected to of course, to the uterus. And then the third hole being that of the anus. So the pelvic floor muscles work with the internal ligaments. Let me advance my slide here. The pelvic floor muscles work with the internal ligaments to provide support for the pelvic organs. So the pelvic organs are going to include your bladder, your uterus, vagina, small intestines, and the rectum. If I go back one slide, you can see some of that. But So those are the organs that the pelvic floor is trying to hold up. And the pelvic floor muscle strengthening can prevent the pelvic floor organs from pressing down through that vaginal opening. The second is the muscle of the pelvic floor, along with the abdominal muscles, back muscles, the diaphragm, stabilize the trunk of the body. So when all of that is stronger, everything stays in its place better. When the trunk is part of the trunk is the part of the body, as we all know, where the arms, legs, and head are attached. The pelvic floor strength can play an important role in preventing the back pain and hip pain. So as we age, also, a lot of times we think we've got back issues, when really it might be that those muscles are not strong enough. So there's lots of different strengthening exercise we can do to strengthen our core, as they say, and strengthening all those muscles will help with the pelvic floor as well. And the third, it controls the entry and exit from the body. The pelvic, as you have a desire to urinate or defecate, your pelvic floor muscles relax to allow you to do that. However, if you'd like to prevent the exit of urine or feces, the muscle can also be contracted. So the pelvic floor muscle strength can prevent leakage of feces and urine. And we all know that feeling when we're trying to hold it in line, if we're going through the grocery store and have got to use the bathroom. We understand how that all works. And if you look at on this next slide here, how does it work? So the bladder, of course, is to prevent the urine from exiting the bladder. Pressure by the muscles that surround the urethra must be greater than the pressure produced by the bladder. And as the bladder fills, pressure increases from within. The pressure provided by the pelvic muscles need to be strong enough to resist the opposing pressure from the liquid filling the bladder. So the goal is that the bladder is not going to be so full and so that your pelvic floor can't hold the urine in. Contracting the pelvic floor muscles is going to activate the brain regions responsible for inhibiting the urinary voiding. So in other words, by contracting or tightening those pelvic floor muscles, it tells your brain to hold the floodgates, hold everything in. Tightening that floor also tells your bladder muscles to relax. So when you're trying to tell your pelvic floor tighten up, it also is telling then the bladder to relax, so that it doesn't try to keep pushing the urine out of your body. Hopefully that makes sense. So the pelvic floor muscles are going to contract to prevent the urine from leaking out. Hopefully, that's the normal. That would be the best thing to happen when that occurs. So there are different types of incontinence, and the first being a sudden compelling desire to void, which is urge incontinence, and stress incontinence. So that's the loss of any amount of urine during an activity that increases the pressure on the bladder. The first one is what Janet Krasinski in our video referred to as key in the door syndrome, is the urge incontinence, because many times it occurs during an activity that's associated with the knowledge that you are near a restroom and that it's time to go. As soon as you walk in the door, time to go to the bathroom. Or also, I'm getting ready to go on a trip. All of a sudden, I need to pee, which I didn't need to go all morning, but all of a sudden now I'm getting ready to go on a trip. So obviously my brain is saying, oh, it's time to go to the bathroom. That is also the urge incontinence. So let's say every time you go to your house, the first thing you do is go to the bathroom. You're training yourself, or your brain is training your bladder to go ahead and empty, because that's what it does when it gets to the house. And stress incontinence, the loss of urine during an activity, which also Janet also discussed as well, the loss of urine during the activity, and what I encountered on Thanksgiving Day last year, a high impact activity, sometimes as running or jump roping. And And sometimes just standing up may cause sometimes people to lose urine, or walking up and down a flight of steps. In either case, the pelvic floor muscles were unable to provide enough resistance to keep the urine from exiting the body. I think Kenna's going to tell us how to prevent it.
Yeah, we're going to talk on preventing, hopefully, because I experienced both of those. I have the key in the door.
Me too.
And I have the activity, the jumping and that kind of stuff as well. And it was just kind of funny when you talk about the key in the door. I told some of them that were on here earlier, it's like, I have this thing, I know I'm getting ready to do a Zoom meeting and I have to pee, And so I fought that resistance today, knowing I can, but it's that mental game your brain plays with you, because you have something you're going to do and you don't want to be interrupted by having to go to the bathroom in the middle of it. So some things we're going to talk about in preventing or correcting this is some good bladder habits, how to avoid bladder irritants, which Janet also talked about because she pointed out some things that affected her, and then a little more on what Joan's been talking about that pelvic floor and how you can make that pelvic floor a little stronger. So we're going to start with good bladder habits. I'm going to tell you, this slide hit me and I'm like, we are to wait 3 to 4 hours between urinating. And there are times that's really easy. And because of and it's kind of, and there are times that it's not. I can do better in the afternoon and evening in that 3 to 4 hour span than I can first thing in the morning. I don't know why. But what they recommend is that you wait 3 to 4 hours between urinating. You might not be there to start with. Might take you a little while to get to that point. So if right now you feel like you're maybe going every hour, try to, increase that to 2 hours till you can get to that point of 3 to 4 hours. Your bladder, your first sensation you get when you're thinking, my first sensation I get is somebody says they have to pee, and that's my first sensation because I immediately then have to pee. Whatever that first sensation is, it's usually probably very little urine in your bladder. And their example of that is maybe the size of a travel size bottle. Then you have this first desire to void. That's when the thought comes. Sometimes mine comes when it's in that first stage too, depending on what my brain's doing. But when you're in that first desire to void, you really only have like a small teacup, a very small amount of urine in the bladder. And when we should be going is waiting for that strong desire to void. And that's when you might have 11 to 18 ounces, a medium to go coffee cup full of urine in your bladder. And I think I was going to show you examples of each of these sizes, but I think you understand that because they're very good visuals of what we all know, what a travel size bottle is, what a teacup looks like. And then when we're maximally full, and I feel like we probably have all been there because we had to hold it and we could and we waited and you feel to that point where if somebody touches your belly, you're going to explode. And then once you sit down, it's like, am I ever going to stop peeing kind of mode? We should probably be at that point more than we are at those first or second points. So I'm not saying it's always waiting till the maximum amount, but the more you can push you off until you have that almost maximum amount desire to urine, that's practicing good bladder habits. That's what you sort of want to try to get to. Definitely want to increase your time between urination. If you feel like you're a frequent urinator, make baby steps. Start small. But our goal is to work to that 3 to 4 hours. So we're practicing those good bladder habits. Your bladder, and this is where, Joan was talking about the different muscles and different things that play into it. Our brain is will trigger you based on those habits you have. So if you can make your brain wait, tell yourself or consistently try to make that a habit of making a longer stretch and span between urinating, it's going to help give you better bladder or good bladder habits.
I want to just interject. It's a real conscious thing that have to try to change those habits in ourselves as well. As you were talking, Ken, I remember I used to teach school in Carrollton, and I would drive an hour each way. I'd teach all day, and I wouldn't necessarily hardly ever use the bathroom at the school. And I had must have had the pelvic floor of steel because I would drink all day, I'd eat, would need to go to the bathroom, but I was training my bladder and my pelvic floor to keep from needing to go, because you can't just leave class in the middle of the day, or in the middle of the class. So
Yeah,
it's one of those
my
things.
yeah, my daughter's a teacher too, and she has said that. I don't know
Mhm.
if I can go all day at school and not have to pee, but I come home and I have to, and well, it's your brain. It's that you see the bathroom, you're there, you know you can use it, so you
You
go.
can use it.
Yeah,
Exactly. That's exactly what I experienced. So
yeah,
now when you can go whenever you want, you just go whenever you want. So we ought to, what you're saying, Ken, is we need to go the other way, is push ourselves a little bit before we go.
yeah. I mean, really, sit down sometime, set a timer. The last time you went to bathroom, set a timer. I mean, most of us, if we have mobile devices, there are timers on there easy. See how long you go before the next time you go to the bathroom. You might think you're waiting a long time.
Mm-hmm.
What might realize is 45 minutes seems like a long time to you. So just kind of practice that. Set a timer, see how long it is between going, and then you'll have a better idea of how often you really go. And do it at different times of the day too, because like I already said, I tend to go more in the morning than I do in the afternoon or evening. And maybe it's because I know it's close, or it's more convenient for me to go more in the morning. So kind of watch that. The other preventative thing or corrective thing that you can do is avoid bladder irritants. You received a couple handouts in your thing, and one of them is going to talk about those different things that irritate our bladder, and that could be different for all of us. These are some common ones that are on here. We have coffee, tea, soda. Some foods include cranberries and tomatoes. But in one of your handouts, there is a whole list, and we're not going to pull it up. We don't have to. I passed out all those handouts yesterday. But there's a whole list of those irritants to the bladder. And yours might even include others that you can write on here as well. And I'm just going to read off some of those additional items that's on that list that I sent out to everyone as a handout. Artificial sweeteners. So your diet soft drinks, the sweet, you drink unsweet tea, but you put artificial sweetener in there. So then you have a double whammy with the tea and the artificial sweetener is an irritant to our bladder. Soft drinks, which is on there as well. Citrus juices, that's what Janet messaged, or not messaged, her message mentioned. Alcohol. Some people, milk is an irritant. Some foods include cantaloupe, spicy foods, dairy foods, peaches, grapes, cranberries, pineapples, plums, strawberries, tomatoes, and things that are vinegary. So that's just a temporary list. And what it's encouraging you to do with this healthy bladder habit handout that is included with this lesson is to keep, how many times a week do you consume these foods and or beverages? And how many times did you urinate because of it? Or did you notice any difference? And is there effect that it plays on your urine? An example in the lesson notes that we were given with this lesson said that one person experienced that there's like the popular sparkly water that became very popular with a lot of people, especially with the younger generation, or I think the younger generation. You might like sparkly water. I don't like bubbles in anything or flavors in my water, but they had just started drinking a lot of the sparkling water. There wasn't many calories. They thought it was very similar to the water, but then they noticed that frequency to urinate more often. And by watching the food and beverages that they were drinking, they came to the conclusion that that was what was making the change in their urinary usage during, our urgency to use the bathroom a little more often. I think we learn our body.
Yeah, a question.
Yes,
Can you hear me?
I can.
Okay. you mentioned the artificial sweetener in soda.
Uh-huh.
So if I drink Diet Coke, I'm hitting a double whammy with the caffeine and the artificial sweetener. Is that it?
That is it.
Oh, wow.
Yeah, if it affects you. Okay.
It does affect me.
Right. So those are
Okay.
things that you have to start learning about your own body. And those are the things that you need to start watching. And that's why they suggested keeping that food and beverage diary of some of those things that irritate us. You know, we tend to know what irritates us more prevalent maybe when it's time to go to bed. And the reason I say this because I'm thinking of Kenna. I know I can drink a pot of coffee and go to bed, and it does not affect if I get up in the middle of the night and go to the bathroom. I drink a glass of tea or a Diet Coke before I go to bed, guarantee I'm going to get up 3 times during the night to go to the bathroom. So then I have learned that about my body by watching what I drink at evening time, so I don't have to get up as frequently during the night. And so those are things that you can watch during the day as well in the evening before you go to bed. Watch those things. I mean, sometimes people might have the total opposite effect. Somebody might be able to drink a cup of tea and go to bed and be fine and not have to pee all night, or drink 1 cup of coffee. And not only are they up all night because the caffeine, they're also peeing all night. You know, so you have to learn your body and what affects it. And everybody is different.
It's interesting kind of that you say that, because I can drink a large glass of water before I go to bed at night and not get up. But if I have a cup of coffee or a couple cups of coffee before bed, which doesn't impact whether or not I go to sleep, but it does impact whether or not I wake up and need to use the bathroom in the night.
Yeah. So those are irritants to your bladder. Mm-hmm. That's what you want to avoid. You want to avoid that interrupted sleep, and you want to avoid those frequent trips to the bathroom during the day. Because remember, our goal is 3 to 4 hours between it. And then our goal is, you know, to like make it all night, hopefully, but it's harder and harder as we age.
Well, as we get our sleep interrupted, sometimes it's difficult for us to fall back to sleep. So we want to try to stay asleep as long as we can, at least in my house anyway.
Right. Very true. And then the other thing that we can do to help us control this and or prevent it is doing those strengthening pelvic floor exercises. You have a handout that is also, oh, I want to go back to, Joan, go back 1 second.
Yeah.
Previous slide, because I forgot to mention your second handout that comes with avoid bladder irritants. There is a bladder diary that you can keep as well that was part of your handouts. And it tells you like the date and time you had that beverage, what kind of beverage it was, how much you drank of that beverage, and what was your rate of urgency to go to the bathroom, that kind of stuff. So that's another tool that you can use trying to determine which of those irritants that might bother you more than others. So both of those handouts were included in what I sent yesterday. Now we can go on to pelvic floor.
Okay.
So in your pelvic floor strengthening, you have a handout.
Do you want me to pull that up, Kenna?
You can pull up that handout, yes. You also, and I will include this with the recording of this lesson, there's like a 10, 11 minute YouTube video of one of the specialists at UK guiding you through pelvic floor exercising.
I'm not able to pull it up.
A visual, did you pull it up?
I didn't, because I guess I don't have it pulled up. I thought I had it.
Yeah.
I thought I had it pulled up. Just a second.
Anyways, while she's pulling it up or looking for it, the handout you has walks you through and tells you what to do. And I don't know if you can kind of see it while she's looking for it, but it's going to walk you through what to do. But if you're a person who likes to watch somebody and do it with somebody, I like to use exercise videos a lot. I will also share with you about an 11-minute YouTube video on actually walking you through pelvic floor exercising. So those,
There we go.
there you go. So basically Natalie, one of our specialists at the university, is showing you how to. She has a ball pinched between her legs. I think in the video, they can pinch a towel between your legs as well. And the position you kind of need to be in to do some of these exercises. And she walks you through a few different exercises, kind of even gives you the guidelines if you scroll down a little bit farther, Joan.
Yeah.
Walks you through doing them, tells you to breathe. A lot of times we exercise, we don't breathe. And then there's that diagram of the pelvic floor that Joan showed even in one of her slides. You know, you hear people say Kegel exercises. I was going to joke with my kids that all the time because I would tell them when Kelsey would be sharing her story, I said, oh, you need to do your whatever exercises. It talks you through how you're going to do that. And sometimes just going to the bathroom and that stop and start of the flow is working on that muscle as well. And so she talks you through a lot of those different exercises, walks you through those in that handout as well. And then in the video that she'll show, it also will show you how to do them, and they demonstrate them. So I will include that in an email as a follow-up to this class as well. That's Miss Janet again on that one. And
yeah. These are very easy exercises and aren't going to require anyone to get out of breath or anything of that nature. It's just a strengthening exercises that certainly this is a real common one as well. It's going to, the hip extension glute bridge, it's going to strengthen that pelvic floor as well as your entire core there and your glutes as well. So the advantages of these is that you're going to have very tight muscles instead of, and your clothes will fit better.
right. And not only that, most of these are low impact.
Very.
Most of these are like, and if you have, some of these you might not be able to do based on what other kind of like issues you might have, if you have issues with your knees or something, and some of them you'll be able to do quite well. As with any kind of exercise, if you have a concern about any of them, make sure you ask your physician before you start doing some of them. But most of these are very low impact. These are just working on strengthening that pelvic floor to help control some of those issues or prevent. So even if you have no issues at all right now, consider yourself lucky. And two, just start doing these exercises so that you do not experience them later on in life as well. I'm going to let Joan pull up the selecting absorbency products.
Okay.
Because that's another handout that you're included. And while she's doing that, I'm going to cover just briefly, when do you go see the doctor? So we've talked about this a lot. We've talked about the issues that we know most of us have. Regardless of your age, people have issues. So when is it time to have that conversation, no matter how embarrassing it might be, with your physician? So if you're getting up multiple times during the night and it's affecting your sleep, it's time for you to talk to your doctor. That is one of the key things. Not only is that interrupted sleep, the interrupted sleep alone has multiple effects on your physical well-being and your emotional well-being. So for that reason, as well as there's a reason that's causing it to happen. So frequent urination during the night, sudden onset of frequency. So all of a sudden you had no problems at all, and then bam, you're having issues all the time. There could be a lot of different things. You've heard people say, oh, their bladder fell. And then they have, that happens at a lot of different ages, especially if you've had children. So there could be a reason that it happened frequently. So that's why you go see your physician. If you have any kind of pain in your pelvic floor, so if there's any discomfort or pain in your pelvic floor, you see a physician. If you're having intercourse and there's any kind of pain there, that's another key, go see a physician. Your inability to fully empty your bladder. Now, I would have thought I never had this issue, inability to fully empty your bladder, but if you've ever had an internal sonogram or had to have had an internal sonogram before, You know that when they do the internal sonogram, you have to drink a ton, hold it in, and then they do a sonogram. Then you have to empty your bladder completely, and then they go back in and they do it again. I mean, I had to go back to the bathroom 5 times because every time I went back, she goes, no, you still got urine in your bladder. Go empty it. I'm like, I can't pee anymore. So sometimes we aren't completely emptying our bladder. And so if you're that inability to fully empty your bladder would be a sign to go see your doctor. If your urine, it's painful to urine, definitely a time. The sense of heaviness or a bulging from your vagina, that's another time that you need to make sure you are in contact with your doctor. And if you continue to leak, no matter what you're doing, you continue to have a leaky tissue, it's time for you and your doctor to make an appointment, no matter how embarrassing it might be, and go have a visit and a conversation with them. So I'm going to let Joan cover this a little bit because this is what she kind of had fun with in her commercial as well. And this
Well,
handout,
before I go on, I will say when we say it's when to see your doctor, there could be something much more medically wrong than just a weak pelvic floor. And so when you are experiencing if you have any of those warning signs, throw embarrassment to the wind because you definitely need to go in and have it checked out. I call these maintenance visits, when you go to the doctor and say, it may not be worth mentioning, but I'm going to mention it because it could be a warning sign of something much, much more serious than just having some incontinence issues.
yep.
But I did go to the grocery store. If any of you got to see my video, it was quite entertaining. But I took my program assistant and we went down to Kroger in Latonia, and we were looking through the long aisle of absorbency products that were available to us. And it could be mind-boggling to someone trying to find the right kind of product. Because if you are experiencing incontinency on a large scale and that you are finding yourself not wanting to go out, there are products that you can use until you get the problems fixed or just learn to live with it so you can continue to live your life. There are so many products. There are briefs, pull-ups, and pads. Knowing which product is the most overwhelming. And so we are providing you with this glossary of different definitions for the most commonly used ones. One being a pad, which all women are very familiar with. It's most closely related to a sanitary napkin, not exactly the same product because it's for different absorbency material. It's contoured to fit your underwear and absorb urine. It could be a liner or a guard or a shield, and probably is used when you have minor leaks, not large leaks on a large scale. A brief could be worn. It's shaped much like a diaper, contains tabs to seal the sides with adhesive or Velcro, and that's easy to remove. So you don't have to remove all of your clothing to get it off to change it if you are someplace out. And then, of course, pull up. And that's similar to a brief as well. It has elastic waistband in the hip area, can be removed, worn and removed similar to underwear. A booster pad is a removable insert, similar to a pad, but without elastic underside. And it can be worn inside a brief or a pull-up. And that gives an extra layer of protection. So if you or someone you know or love is having much more significant leakage than what a regular pull-up would have, then there are booster pads as well. And then super absorbent polymer that can absorb up to 300 times its weight in fluids. So it is used in baby diapers, incontinence products, feminine hygiene products, because once it absorbs, it does not release the fluid. So you're not going to have it leak outside onto your clothing. That material will hold that fluid in.
Joan, can you give brand names of those last two?
I do not have a brand name for that. I can look that up in just a moment and give you some ideas
Yeah.
and direction and where to find those. Some of them may not be available at the grocery store or the store that you shop at. So I'll do a little bit of research and look up some brand names for you,
Okay.
and try to get that to you. If I don't get it before the end of the program, then I'll definitely get it out to everyone.
Because
But
sometimes what I do is I'll wear the poise pad, and then when I'm going out, I'll put on a brief as an extra protection.
Okay.
But I hadn't heard of this booster pad. So
Okay, so that would be helpful to have that then, wouldn't it? So you
I
could,
guess if it's more absorbent. Yeah. Okay.
Yeah.
Thank you.
You're welcome. You're welcome. So planning ahead and learn how to select a product that's going to fit your specific needs. You may be able to relieve some of the product related worries, the leaking, using products that don't mask smells. You want to make sure that you feel comfortable as you go out, and so that you can continue to live a very vibrant life. And we don't get to go very many places these days. So when we get a chance, we want to make sure that we are feeling good about ourselves when we go out in public, for sure. So everyone is going to be different. So a product that might work for myself might not be the best product for someone else. Also, our bodies are different. So they're shaped differently. So trying to find the right product or combination of products for you is key. And there's certainly, years and years ago, they didn't have these kind of products just out in the grocery store for us to find. There might be one product. Now there's a whole aisle full of products, which is wonderful, to be able to be able to utilize those. Recommended for women without mobility issues, light incontinence that leaks up to about 100 milligrams, disposable menstrual pads are acceptable, and cost-effective option, because let's face it, the market has us. There are products that we have to have, and they charge us. So finding a less expensive option sometimes is better. So if you have light incontinence, menstrual pads are going to work fine. They're limited to only about 5 to 15 milliliters of fluid though. So, and they have to be changed more often in managing that light urinary incontinence, but also, even though you might have to change them more often, it might be easier to change them if you are in an area where you have a place that you can go to change. Women with moderate to heavy daytime urinary incontinence can use disposable pull-ups, super absorbent polymer with that super absorbent technology. And for moderate to heavy daytime, the disposable shape pads worn with close-fitting underwear is another suitable option. Making sure that the underwear that you choose to wear fits you well and also fits with the product that you are using. So it may not be the underwear that you have chosen that you used to wear on a regular basis. Now you're adding a layer there. It may not fit you the same. So finding the type of underwear that fits well with your product is important. The study results do say that brand name products tend to work better than generic products. And when I think about when I was a young mom and trying to find diapers that worked for my kids, people always say Pampers works better, but I found that Loves work better for my kids because of their body shape and so forth. But interesting fact, and I digress a little bit, I was at Procter & Gamble on a tour, and they talked about Pampers versus Loves. You know, Procter & Gamble makes both of those products, or they did at the time. And I mentioned to the tour guide, well, my oldest one, I always use Loves because the Pampers never worked very well. They were terrible. And I said, and then by the time my third child came along, the Pampers were better, and I didn't understand it. And he said that's because the Loves brand team did such a great job on the Loves brand that it was better than the Pamper brand back in 1995, and they had to flip-flop the brands. That they turned the Loves product that I thought was Loves that my youngest one was wearing was not. It was the it was the old Pamper. So they flip-flopped the brands, and they were charging more for the Pampers than they were the Love, so they flip-flopped them. So sometimes it's a little experiment on your own, trying to figure out what works best for you as well. When choosing your product, consider the fit and the comfort, and also the size as well, your waist and hip circumference, and it may help you narrow down your product and what product works best when you're looking at the size of the product. So making sure that it's comfortable to you, it fits well, and you don't feel self-conscious about the product you're wearing. My daughter's always so self-conscious about anything that might show. And like, I don't even pay that much attention, but some people do. Some women, that they're very self-conscious about that. So recognize what you feel the most comfortable in. Well, certain ointments and creams also can interfere with an absorption of any product. So if your product leaks, check to see if an ointment or cream is responsible, if you're using an ointment or some kind of cream. Applying cornstarch or talc or shaving does not reduce odor or optimize your skin health. So that's not necessary to use that. And also can interfere with the absorption, so make sure. And changing your product based on times that promote skin health, odor control, also in the elimination of patterns and dignity. Consider using a booster pad, and I will, Dee, in a minute, look for that brand name for that. And in the evening as well, if people want to use those. And do not use an unbreathable plastic outer layer or rubber pants to protect your outer clothing, because it could lead to some moisture-related skin damage. You could cause maybe a type of yeast infection on your skin because it's holding moisture in. So try not to use those outer layers. And no one product is going to meet your needs. So consider using different types of products in the day versus nighttime, and consider what kind of activities you're going to be involved in while you're using the product. Disposable products are less likely to leak than reusable products. People like to use reusable because, they consider it saving money, and it's definitely sometimes a cost savings, but there are lots of different activities. It's just not the best thing to do always, because if you're out in public, and you may experience some leakage when you're using a reusable product. Does anyone have any questions besides Dee? And I will stop sharing my screen there, and I
think that's all. We don't have to go back to sharing another screen.
Okay.
I think we're pretty much wrapping it up. And we've kind of, right now, we're open to any questions that you might have. You can unmute yourself and ask them. You can type them in the chat if you want, or maybe you don't have any questions. Maybe Joan and I covered it. So maybe you're still in that stage, I really don't want to talk about it. But it is a lesson that all women need to have access to, hear, not be uncomfortable talking and sharing about. It's just part of life. That's what happens to us. It's happens to us, and happens to us at different ages. So our biggest issue is it's sometimes embarrassing, and we choose not to talk about it, and or knowing when it's an issue that needs to be discussed with a physician. So
when I've looked up a couple brand names for the booster pads, and they are sold as booster pads. Attens has a booster pad. That's the brand name. Also, another one is called North Shore. There's one called Reassure and Tranquility. So they are sold directly as a double dignity booster pad. So I think it may be one of those specific things if you're in a store or at a pharmacy, if you don't see them there, they may be down to the side or off in a corner, you know, and just have a small selection of them. They may not have a large selection of them, but if that
Yes,
gives you an idea.
on a note to that too, that if you have any grandkids and or kids that are in childbearing age, I was doing this lesson and I said, "Oh, Mariah, do you know they make these?" And she has an issue with my grandson, who is 1.5, peeing through every night his diapers, and no matter what brand, nighttime diapers, whatever. Well, they make booster pads for diapers as well.
Wow.
She got the booster pad to go inside the diaper, so she wasn't changing the bed every night and having to clean or wash pajamas every night as well. So because of this lesson, she figured out they have them for diapers too, which
Great.
I didn't know. So good to know in case you know someone at that age too and complaining about your grandchild peeing through every night or something, you know?
You're right.
So that,
I did have a question on here. It was private. What's the origin or basis of the list? And I don't know how long ago that question was asked. So I don't know if it was the list of the products or not. But that's just the base for the list of the different products on that list. Those were just the basic research products that during the research of putting the lesson together, those were the products that were available. Oh, the bladder irritants. She's like the bladder irritants.
oh, I mean, this lesson is a fairly new lesson that was there like in the last couple of years by the specialists. Actually, it was brand new to homemakers. They asked your choice for a homemaker lesson this year. So this information has been put together within the last year and a half. So it's a very current list of those bladder irritants. And that's just a few.
Right.
Everybody's irritant could be different. You could have an irritant that's not even on the list that's in the handout that's given to you. It's just the most common ones based on what people report.
Also, I want to share that one of our participants shared that a certain brand product could irritate the skin while another does not. So one brand of a product caused this person to have a skin irritation, I guess, and the other one did not. So don't rule out all the products because one of them didn't work for you. They're all different brands out there. So I appreciate that that person sharing that with us. So.
And really, if you just look from a marketing standpoint, you have to know it's a common issue among women because look at all the commercials that are out there now about the different products that are available and how they're making them pretty and how they're making you, feel comfortable in them and how you have no lines, so it's a very common thing or else there wouldn't be so many commercials about it out there.
Well, also notice in their marketing campaign, since we started working on this lesson, Kenna, I have noticed how young and active all the people are in the commercials because it isn't an issue just for the older people like us that have had children or starting to age and have a weaker pelvic floor. So,
yeah.
And then sometimes also, I will bring this up, there are times when people have gone to the doctor. My mother's doctor has been trying to encourage her for years to have some things tacked up to help with that, with everything falling, her organs falling and pushing on her pelvic floor. But then I was talking to a coworker the other day, and she was in a class, and one of the participants in the class shared that her doctor, she was taking Botox for incontinence. And so I'd never heard of this and looked it up, and sure enough, on the Mayo Clinic, that is a treatment for people with, I imagine, severe incontinence, that they actually inject Botox into the bladder. So it is a question to ask for certainly if someone has to go to the doctor to learn or to find out what are options. Maybe that is something to ask about, what if that is an option. I don't like injections. But apparently Botox isn't just for getting rid of your wrinkles in your eyes.
Yeah. Interesting. All right, ladies, that's kind of what we got. I'm going to hit stop